Hello, everyone. My name is Eric K. Thomas, and I am the editor-in-chief of the Quintessential Gentleman. And today we are going to be talking about sickle cell disease, and specifically in the Black community and Black men. And today we are speaking with Tiffany Taylor, who is a biomedical communication specialist on the American Red Cross National Headquarters team. Hey, Ms. Taylor, how are you?
I'm well. How are you, Eric?
Doing well. Staying, kind of cold, kind of warm. I'm in New York City, so the temperature's all over the place depending on the day. Where are you?
I'm down south, based in Nashville, so we have a little bit, both worlds. Warm during the day and cold at night.
Perfect. That's awesome. Well, thank you for taking the time to speak with us today. There's a conversation that needs to have. September was Sickle Cell Awareness Month, and what we want to do is just really have a conversation around sickle cell, the disease, the different diseases within it. I know there's like sickle cell anemia and things like that, and just want to get more of an understanding about the disease itself, and then specifically how it affects our community, and if we can try to figure out what some tips of living with it or things that you can, potentially look at if there's symptoms that you may have it, reasons to get checked out and things like that. Does that sound great?
Sounds good.
Perfect. So can we first start with what is sickle cell disease?
Well, sickle cell disease is the most common genetic blood disease in the US. Sickle cell actually causes red blood cells to become hard and crescent shaped like a C, instead of soft and round. And as a result, because it's C-shaped, it has difficulty flowing smoothly and carrying oxygen to the rest of the body. And so what this does is it causes what we call sickling, and it causes severe pain, tissue, and even organ damage. It can also cause acute anemia, which is where we get the term sickle cell anemia, and even strokes.
Wow. So is this something that, I just kind of get a pain in my arm, or it's, just my blood, kind of feels a certain type of way? Like, how would I know without being diagnosed? Are there any type of things that I can kind of see as like a symptoms that, oh, you may need to get checked out?
Well, I do not have sickle cell, but when I've spoken with those who battle sickle cell, one person in particular described it as like a rain shower of daggers. And if you think about rain, you never know which direction it will fall. It can come in multiple directions all at one time. It can be light, it could be heavy. And so her description of a pain crisis, that stuck with me, because I could imagine a rain shower of daggers piercing you, causing acute pain. And so when I've talked with patients who have sickle cell disease, many of them say that the pain can be anywhere in their body. It could start in their feet, it could start in their joints, and spread and move. And that's the unpredictability of the disease. You never know when it will hit. You never know how it will hit and how severe it will be, or how long it will last.
I was going to ask too. I was going to say, like, is it just like a pain ahead? But you're saying that there's a time period that sometimes it could go on for a certain period of time, right?
For sure. It could last for hours to days. And that's more so a severe sickle cell crisis in which that patient will definitely need medical care. And most likely blood transfusion.
So the blood transfusion standpoint, is that to remove the disease that's happening inside your blood in order to get new blood? And excuse my ignorance for not being a doctor, I understand any of the medical terms, but what consists of a blood transfusion, and why would someone need to have that if the case is so severe?
I'm not a doctor either. So blood transfusion can be needed for many reasons, sickle cell as well as other conditions. Some people have sickle cell because they're, as it relates to sickle cell disease, as I stated, the main cause of sickle cell disease is that lack of the ability of those red blood cells to be able to move freely and transfer oxygen throughout the body, which causes the severe pain. So by having a blood transfusion, that allows that individual who's going through that crisis to receive blood, fresh red blood cells from someone whose red blood cells are not sickle, they're round shaped. And so it's going to help their blood begin to not be sticky and not cause pain, and allow more free flowing movement to all of their organs.
Right, right. So why is this disease so prevalent in the Black community?
Well, in the US, it's estimated that over 100,000 people, the majority of whom are of African descent, have sickle cell disease and may require blood transfusion throughout their lifetime to help manage their disease. So to answer your question, we as African Americans or Black people who have African descent, we come from areas of the Mediterranean. And so it doesn't just impact Black people, it impacts white people. It largely impacts Hispanics, but it does disproportionately impact the Black community, which is why the American Red Cross launched its National Sickle Cell Initiative to grow the number of blood donors who are Black, to help patients with sickle cell disease and to also improve their health outcomes, because it is a health disparity. The fact that it largely impacts the Black community, but yet and the disease has been discovered, more than a century ago, but yet there has not been as many advancements towards the disease. There's not as much funding towards the disease. Makes it a health disparity. There's also not as much specific knowledge within the medical community in terms of primary care with nurses, as well as primary care physicians as it relates to treating sickle cell specifically. And so hematologists are definitely needed in the care of those patients with sickle cell because of these health disparities. So there are so many reasons. As I said, it's not, sickle cell disease is not limited to just Black people. It's not a Black disease, but it disproportionately impacts us.
Yeah, yeah. I wonder if there's, some type of correlation, after getting the disease, but, thinking of, dying from the disease and not necessarily having, medical insurance or having the doctors and things like that normally found in our community, that kind of leads us to suffer so much more given this type of disease than others.
Socioeconomic aspects always play a huge factor in one's ability to be able to get quality care and treatment. And so that definitely does play a factor in it as well.
Yeah. So kind of the sickle cell, the disease, kind of stemming from, people African descent or in a particular area, or just geographically where you're found. So there's nothing that we can do to prevent this, correct? This is kind of something that just develops in your body and you just don't know, correct?
It's a genetic disease. There's nothing you can do to prevent it. And it occurs when both of the parents have the sickle cell trait present within their genes. And so as a result, when both of the parents have a presence of the sickle cell trait, their child has a 25% chance of either having sickle cell disease or having a sickle cell trait only. The difference between sickle cell disease and sickle cell trait is oftentimes those with sickle cell trait, they don't present with the same symptoms or issues or concerns as someone with sickle cell disease. However, each individual is different. We've seen over the years, especially those who have discovered they have the sickle cell trait and play sports. Some of them deal with cramps and pain that are very kind of similar to sickle cell disease, but not as severe. And so they have to make sure that they stay hydrated and monitor, in terms of their temperatures or where they are, if they're in areas of high altitude, how that may impact their sickle cell trait symptoms. So we're learning so much in terms of the differences as it relates to trait as well as disease. But one thing that's interesting is that not until 2006 was it made mandatory in all 50 states of the US for all newborn babies to be screened for the sickle cell trait.
Wow.
So for a long time, many parents were not learning about their child having sickle cell disease or the trait unless they had a symptom and they, checked on it and were able to see, okay, at that point, we've run some tests and we're able to say or see that your child has sickle cell disease or sickle cell trait. With that being said, there are generations of Black people to this day who may not know their sickle cell trait status. So one of the things that the American Red Cross is doing with this initiative is that every individual who presents to give blood and self-identifies as African American, we will automatically test your blood donation for sickle cell trait at no cost to you, and we will provide those results to you within 1 to 2 weeks within our Red Cross blood donor app. And with that information, we would just encourage you, if you do test positive for the sickle cell trait, to follow up with your primary care physician to find out what that means for you as it relates to you individually and your health care. But also too, someone may be asking, well, if the person with sickle cell trait donated blood and they found out they had sickle cell trait, is there something wrong with it? Are they unable to donate blood? No, those with sickle cell trait can donate blood. And so that's, something that many people don't know as well. And so this initiative to really increase the number of blood donors within the Black community is huge and it's game changing, because what many people do not know is that those who have sickle cell disease, who rely on constant blood transfusions, we have patients who have to have a blood transfusion every 4 to 6 weeks, or sometimes every 4 to 8 weeks, just to be able to live a fairly decent, normal life, to be able to go to work, go to school, take care of their family. They rely on 4 to 6 units of blood transfusion every 4 to 6 or 4 to 8 weeks. And then we have individuals who may just, need a blood transfusion when they have a crisis. But what happens over time is the more blood transfusions you have, the more the body builds up immunity to the blood transfusions. And your body then requires you to have a more closely matched blood type that's being transfused to you. So closely matched that it will require a blood transfusion from someone of the same race or similar ethnicity, and potentially the same blood type. So if we do not have a diverse blood supply, that hinders the ability of those who are battling sickle cell disease to get that closely matched blood transfusion. And what can happen if their blood transfusion is not closely matched, they can actually have a reaction that can be more so like seizure-like and feel like death for that patient.
Wow. I want to talk more about donations, donating blood and things like that. Just kind of some of the misconceptions and conversation that goes with that. But before we go there, I would like to know, I know that blood transfusions is kind of like the, I'll say worst case scenario, or the thing that, hope people don't have to do in order to live with sickle cell, the disease. But are there any other things that people with sickle cell disease are able to do, or to kind of manage the, the pain or their kind of lifestyle? Are there any type of things out there or things that they should be paying attention to or do?
I'm not a physician, so I can't advise what a patient with sickle cell can or cannot do in terms of their treatment. I would definitely encourage them to talk with their primary care as well as their hematologist. And if they do not have a hematologist, I would encourage them to get one, because they are that's their specialty, and they specialize in the treatment of sickle cell care, which is why earlier I mentioned to you the health disparities, even in the medical industry, in terms of the knowledge of proper treatment of sickle cell. And so I would definitely advise that. I have heard individual patients, trying certain things, making sure they stay hydrated, making sure they listen to their body, making sure that they rest when they feel overworked, so that they can limit stress, because stress can bring on the onset of a sickle cell crisis. But at the end of the day, there is a cure for sickle cell disease. It's through a stem cell or bone marrow transplant. And there's also some emerging gene therapy approaches as well. But with these treatments, they're not widely available, and they have age cutoffs. Wow. And with individuals who have sickle cell, sometimes they can have a stroke at 5 years old, which changes their health condition and limits if they're even eligible to be able to have a stem cell or bone marrow transplant. So you talk about blood transfusion. Blood transfusion really is a lifeline. It's a life-saving treatment for patients with sickle cell who go through crisis. It can help them mitigate having strokes. Yeah. And so it's needed. And of course, blood can only come from another generous human being who's willing to roll up their sleeve and give the gift of life, just to ensure that a patient with sickle cell has a better quality of life and also can have life.
So true, so true. Talking about donating blood, there's a lot of conversations around, well, I'm not even gonna get into the conspiracy theories, but specifically about giving blood at certain times and how much blood you're able to give. Can you kind of give some of the parameters for that? So for instance, if I give blood, let's start there. How often can I give blood?
That's a great question. So you can give whole blood, which is just a regular blood donation, every 56 days, which I think when you round it up, it's about 8 weeks. You're eligible to donate blood. Some people question whether or not, I can't give blood because, this, or what if I don't have enough blood left? You have enough blood in your body to be able to donate blood. We just ask that you be feeling healthy and well. All you need to be is at least 16 years of age with parental consent, 17 years of age without parental consent, and there's no age cap. We do have eligibility requirements, and those eligibility requirements can be found on our website at redcrossblood.org. And that can be based on if you've had some out of the country travel, if you have, take certain medications, things of that nature. And so it's very detailed on our site. And of course, each individual is different. So I definitely encourage those who are considering to give blood, which I hope you are considering to give blood, that you'll visit us there at redcrossblood.org to check on your eligibility. But also too, some of the common misconceptions and some of the things that tend to impact the Black community a lot, like hypertension, high blood pressure, or diabetes. Sometimes we get these diagnoses and we think that we can't donate blood. And it's not that we've been told we can't, we just assume that we can't. And the truth of the matter is, if you have these conditions and they're well managed with your medication, you are eligible to donate blood. We also provide a mini health physical to any individual who presents to donate blood, where we check your blood pressure, we check your iron levels, and we're able to track over time how those levels are doing, and even provide that health history information to you at no cost to you that you can take back to discuss with your primary care physician. So there's so many benefits to donating blood. Yes, you're helping to save lives. You're actually helping to save up to 3 lives when you donate 1 pint of blood every 56 days, or, you know, when you can get it scheduled in around your schedule. But you're also finding out valuable health history information that will benefit you as well.
Awesome. And this may be new, but since everything is going on, has there been any conversations around effects of COVID-19 or having COVID-19 and being able to give blood?
What we ask you to do as it relates to COVID-19, one thing about giving blood, it's an essential need. So throughout the entire pandemic, we have been hosting blood drives, and we've been communicating with the public about COVID-19, as well as the vaccine and eligibility to donate blood. So of course, if you're not feeling healthy or feeling well, you're not eligible to present to give blood. And so that would be the same thing if you have a COVID-19 diagnosis. We would not encourage you to come and give blood. We would encourage you to follow CDC guidance, as well as your medical health providers guidance in terms of you know, getting back healthy. But during the pandemic, we were able to really rely on a number of individuals who had COVID and got better, and they were able, when we didn't have a vaccine, to donate what we call convalescent plasma. And that convalescent plasma was used in the treatment of many patients who had severe illness as a result of COVID-19 in the hospital. And so convalescent plasma is something that has been traditionally used in years when there hasn't been a vaccine for certain types of illnesses. And it's basically something that you can do once your body has built up antibodies to fight off the virus. Sometimes we have antibodies, not simply because we had COVID-19, but because we may have come in contact with COVID-19. And so that was another thing that we were doing during the beginning of the pandemic. Before we had readily available vaccines, we were providing antibody testing to all presenting donors, just so they could know during a time when we didn't even really have a lot of access to COVID-19 testing, if perhaps they had come in contact with the virus. So to answer your question about the ability or eligibility for those to donate blood in light of COVID-19, if you have it, we ask that you recover and consider donating afterwards. One thing we need to know is, just because you have those antibodies, it does not, COVID-19 cannot be transferred through blood transfusion. That's not scientifically based. So the blood supply will be safe. And we also make sure that we test all blood donations for all infectious diseases anyway, just to ensure we maintain a safe blood supply. We're also regulated by the FDA, so we go through strict regulation as it relates to that. If you've had the vaccine, what we just need to know when you present to donate is the name of the vaccine that you've had, and when you've had the vaccine. It's just for our knowledge and information to be aware, to make sure that you are eligible to give on that day.
Awesome. Thank you for that. And my last question is if you have any more information about the American Red Cross Sickle Cell Disease Initiative that you would like to share with us.
For sure. I would just like to encourage all my brothers and sisters in the Black community to consider giving the gift of life. I myself am a second-generation blood donor. I started donating at 16 years old because my father was a blood donor, and Red Cross would call the house and ask him to give. One day I asked him, why do they call you so often to come back and give? And he said, it's because I have O-type blood and so do you. And O-type blood is always needed. Yeah. And so what I would like to share with the community today is that O type blood is very prevalent in our community, O positive and O negative. And it's almost like we have a superpower because with because with O negative blood, we do, because with O negative blood, it can be transfused to any patient, regardless of their blood type. And in times of emergencies, when there's not enough time to type the individual's blood type, that is what medical professionals reach for when time is of the essence. The O neg blood, the O positive blood, which is what I have, is also critically needed for babies in the NICU, because there are special antigens in our blood that help them to strengthen and recover. So we are an amazing people with an amazing superpower that we predominantly have the O-type blood. So imagine the impact we could make for not only patients with sickle cell disease who may rely on constant transfusions and eventually need a more compatible blood transfusion from someone of a similar race and ethnicity and blood type. But also imagine what we can do just in general. If someone has a car accident, if someone has a slip and fall like my grandmother had 2 years ago, and because she was on blood thinners, she lost so much blood and required a blood transfusion. So the need for blood is constant. Right now, we have an emergency blood shortage across the country. And we also know we're going through the pandemic. Our patients with sickle cell are already concerned about, getting COVID-19 and what that could do to their bodies, just having that infection and how their bodies would have to fight that much harder. What we don't want them wondering is when they need the blood to live and survive, if it is there.
So true. Thank you, Ms. Taylor, for that. I really appreciate it. Thank you for so much. I'm happy to have this conversation. I've been wanting to have this conversation. I know my cousin is going to be grateful to have this conversation and probably go give me a call and say, how come I didn't call her to join in on this conversation? She's an advocate. But
Are you serious? You should have called her.
I'm telling you,
I would love to meet. Is it she?
Terry Booker.
I would love to meet her.
Yeah, she'll see this on Instagram. I'm gonna let her see it on social media. I'm not even gonna call her and give it a heads up, as I know she'll catch it. But this was a great conversation. Thank you so much for this informative conversation. Thank you for the work that you do. I always tell people, giving blood, you think about doing it for other people, but I also think people are self-deserving and very self-centered. But think about when you need blood and someone needs to be able to give that to you. So you have to offer that to other people for sure. So thank you so much. I really appreciate this conversation. This was amazing.